Abscess is a common medical condition characterized by a localized collection of pus, which forms as a result of an infection. This condition can occur in various parts of the body and may cause pain, swelling, and other discomforting symptoms. Timely recognition and appropriate treatment of abscesses are crucial to prevent complications and promote healing. Causes: abscesses typically develop when bacteria, fungi, or other microorganisms enter the body through a wound, cut, or pre-existing infection. These microorganisms proliferate within the affected area, leading to the formation of pus and the subsequent development of an abscess. Common sources of abscesses include bacterial skin infections like cellulitis, infected hair follicles, folliculitis, and infected sweat glands, hidradenitis suppurativa. Abscesses can also occur in internal organs, such as the liver, lungs, or brain, due to systemic infections or underlying conditions. Symptoms: the symptoms of an abscess can vary depending on its location and severity. However, some common signs and symptoms include localized swelling. The affected area may appear red, swollen, and tender to the touch. Pain. Abscesses are often associated with localized pain or throbbing. Pus drainage. As the abscess progresses, it may develop a fluctuant area filled with pus, which can eventually drain through an opening or be surgically drained. Fever. In some cases, an abscess can cause systemic symptoms, such as fever, chills, and malaise. Localized warmth. The skin over the abscess may feel warm to the touch due to the inflammatory response. It is important to note that abscesses can vary significantly in size and severity. Small abscesses may be relatively painless and resolve on their own, while larger or deeper abscesses require medical intervention for proper treatment. Treatment. The treatment of a medical abscess typically involves a combination of interventions, including incision and drainage. For most abscesses, a healthcare professional will need to make a small incision to allow the pus to drain out. This procedure helps relieve pain, reduce swelling, and promote healing. Antibiotics. In cases where the infection is severe or has spread to surrounding tissues, oral or intravenous antibiotics may be prescribed to eliminate the underlying infection and prevent further complications. Pain management. Over-the-counter pain relievers or prescribed medications may be recommended to alleviate discomfort associated with the abscess. Wound care. After drainage, proper wound care is essential to prevent reinfection. This may involve cleaning the wound, applying dressings, and following specific instructions provided by healthcare professionals. Treatment of underlying conditions. If the abscess is related to an underlying medical condition, such as hidradenitis suppurativa or dental infection, appropriate treatment for the underlying cause is necessary to prevent recurrent abscesses. In some cases, particularly for deep-seated or recurrent abscesses, further investigation may be required to identify and address any underlying causes or predisposing factors. This can involve imaging studies, blood tests, or consultation with specialists, depending on the specific circumstances. Prevention. While it may not always be possible to prevent abscesses entirely, certain measures can reduce the risk of developing them. These include maintaining good hygiene. Regular hand washing and proper wound care can help prevent the entry of harmful microorganisms. Avoiding skin trauma. Taking precautions to minimize cuts, scratches, and other forms of skin trauma can reduce the risk of infection. Treating underlying conditions. Managing conditions such as diabetes, immune system disorders, and chronic skin conditions can help prevent recurrent abscesses. Avoiding self-squeezing or popping. Refraining from squeezing or popping pimples, boils, or other skin lesions can prevent the spread of infection and the formation of abscesses. In conclusion, a medical abscess is a localized collection of pus that develops as a result of an infection. Prompt recognition and appropriate treatment are essential for optimal outcomes. If you suspect the presence of an abscess or experience symptoms suggestive of an abscess, it is important to seek medical attention to receive an accurate diagnosis and appropriate treatment to promote healing and prevent complications.